Hi guys, my name is Mia, and today I'm going to argue why the UNM Grand Challenge Substance Abuse Disorders deserves more attention at the regional, global, and national level. Now, my first thought when I think of substance abuse is how greatly those individuals, friends, and family are affected by their loved ones' actions. Now, knowing that substance abuse is a common concern or issue for society, I would like to ask, how much of an influence does substance abuse have in our community, or have you ever been personally affected by substance abuse either directly or indirectly? Now, after thinking about these questions, I'm sure many of you have a lot of shared emotions. So, when I was looking at New Mexico as a state, I was able to see that our state is known for many of its substance abuse battles, which is very sad and disheartening to hear. While researching, I found on the Sage Clinic website that some statistics regarding substance abuse in New Mexico. Some of those are like students in New Mexico have some of the highest rates of drug use among the nation's youth. Unintentional drug overdoses in New Mexico made up 88% of drug overdose deaths. And then New Mexico is known as the 15th highest drug overdose death rate in the US as of 2018. Now, although New Mexico has invested in collaborative research, there needs to be more urgency in awareness of New Mexico's substance abuse. Not even in New Mexico, even beyond that, at a national level. Because one, we need to find a better and effective ways of prevention. Two, we need to invest in treatment plans and centers for those who are struggling. And three, we need to look in our policies based on substance abuse disorders in New Mexico. Again, with all this in mind, we can look forward to a greater and better future and collaboration in our community. So, on to my first main idea, which is prevention. The first line of defense in substance abuse is through the prevention and education of substance abuse. With that in mind, while I was researching, I found a lot of prevention strategies, and I believe I found these prevention strategies on the Hawaii government website. I was looking at a lot of their policies and their concerns and their goals as far as substances, and it really gave me a good insight into like what we're doing nationally about it. Some of those strategies that they listed are things like information dissemination, alternatives, problem identifications and referral, and community-based process. And then one of the ones that I feel is the most important is prevention education. Now, I feel like by adding the element of education, society will be more willing to help those in need by learning about the effects of substance abuse that they can have on just the individual person, like I said, their families, their communities, and even further than that. On to my next main idea, which is treatment. I cannot stress enough how important I feel treatment is and how much it's needed throughout our communities and throughout our society. So, by starting off, I'd like to ask the question, how can we improve access to evidence-based substance use treatments in rural communities? I found this question really intriguing, especially considering that New Mexico is comprised of mostly rural communities. In these rural communities, obviously, treatment is very limited and we have very little access to it, which doesn't make the healing process easy. I found that on the UNM site, they said that 76% of fatal drug overdoses happen among individuals released from prison and occur within 2 weeks of their release. So this just shows that this research needs to focus on methods of improving access to healthcare and to treatments for individuals who, like the example I just stated, were in the criminal justice system and get exposed to those rural communities. To continue, there is a number of resources that are available to substance abuse disorders and dealing with that treatment. And I would like to say that the treatment process, I feel like, is very specific to the individual, and it's not like one size fits all. It's specialized to treat that individual and work on their goals and their needs. And in that treatment plan, there's what's known as 3 elements, which it could be interventions, objectives, and goals. So again, I think it's really important to emphasize that it's not just one size fits all, that everyone can go through treatment, everyone can have a different plan, and everyone can get help, and everyone can feel safe and comfortable within the space they're supposed to be in. Now for my last main idea, I'm going to focus on policies. The importance of policies. I feel like policies are really important because it kind of like sets in place like our goals and objectives of what we are looking forward to doing. And hopefully with a policy in place, it gets people more riled up about the issue that we're talking about and be more passionate about what's coming ahead and the issue at place. New Mexico, while researching, I found that New Mexico has what's known as a Drug Policy Alliance. The focus areas of this alliance include ensuring the implementation of legalization of marijuana addresses equity and social justice, decriminalizing all drug use and possession, devising new strategies to prevent drug overdose fatalities, exposing the roots of drug war in civil system, supporting implementation of an injectable opioid treatment program, etc. Those are just some that I was going to list off. With this, I'd like to leave the question of how could policies affect substance abuse? And I feel like with this in mind, the policies can greatly affect substance abuse, like I stated earlier. I can give like drive and passion to the issue at hand and hopefully make our community stronger and want to work towards those goals. Now, in conclusion, I argued that we need to pay attention to the topic of substance abuse disorders so that way we can reduce the prevalence and impact of substance abuse disorders. Sorry, I think I just said that twice. So that we can reduce the prevalence and impact and live in a more controlled community and society. I also think it's important that we raise awareness for this so that we become more educated and supportive for those struggling individuals, knowing that there's someone always there to help. And yeah, thank you for listening.